Austria is having another nationwide lockdown that's spurring violent protests with 64% of its population inoculated. This, to me, is mind-boggling. Over in Germany, the rate is 69%. In Southern Europe, it's even greater. Why is the discussion about the wave in Europe? And is there no discussion about the United States? Joshua Sharfstein has been joining us for this point and many others over the past months. Vice Dean of the Johns Hopkins Bloomberg School of Public Health. Dr. Sharfstein, what do you make of this?
Well, I think a lot in public health is compared to what? So where we are now is not at all good. We have still 1,000 deaths a day, but compared to where we were a few months ago, things are getting better. People feel a little bit more optimistic in different parts of the country. People, on the other hand, feel like we didn't have mandates, and now I either have to get a vaccine or get tested for my job. That seems like an imposition. But if you compare that to what's going on in other countries where people are countries are taking much more stringent measures, you realize that what we're doing in the United States is actually pretty reasonable.
Well, but Dr. Sharfstein, can we just take a step back? I mean, yes, there is this sort of messaging aspect of this, but why is it that the United States is not facing the same kind of wave that we're seeing over in Europe, even though the vaccination rate is so much higher in Europe?
Well, we had that wave in many parts of the country, and it really depends on the region, like you said. So, Mississippi's had that wave, Florida's had that wave. It was terrible. I mean, we were building intensive care units and hospital beds in parking structures. In other parts of the country, though, the vaccination rate is so much higher than in those parts of Europe that are having problems. We just are not seeing the surge in cases.
Dr. Sharfstein, we had the plague wash through the Keene household over the last week, just your common cold and all that. And one of the cherubs had to be tested just to be sure they're okay and they're fine and all that. Can you tell if you have COVID? If somebody gets a cold, can you say, ooh, I think it's COVID?
Well, it's a good idea to get tested, so you did exactly the right thing. The symptom that is the most distinguishing is the loss of smell. So if you lose your smell, then you have a pretty high likelihood of getting COVID. But if you don't lose your smell, you could still have COVID, and that's why it's important to get tested.
Yeah, that was very good, Kaylee. I didn't lose my smell of juniper, so it worked out okay.
I did. I couldn't taste anything for months. It was horrible.
Yeah, well, we'll have to see. I looked, Dr. Sharfstein, at where we are on this, and the question, as Lisa brings up, is 59%. What's the plan to get to just at the margin 62 or 63%?
Well, I see that plan in action in Baltimore, where I go out and vaccinate as a volunteer with the health department, and they are focusing using maps on neighborhoods where there's still a lot of people who are unvaccinated. They go door to door talking to people. They set up little vaccine clinics right there, and they're continually getting more and more first doses in. The other major strategy is to, rely on requirements for jobs where it really matters. For people to be safe in the workplace, given the nature of the work. And I think sticking with that for hospitals, nursing homes, and many other employers that are going to potentially be at risk for outbreaks makes sense too. And there are a lot of people still who show up to get vaccinated, and you ask them why it's taking them so long, and they go, I don't know, but now I have a job requirement. And they're not all that bent out of shape about it. They just know it's something they have to do.
Okay, so Dr. Sharfstein, given current vaccination levels, given, as you said, we saw a surge prior to Europe's fourth wave, does that mean this winter actually won't be that bad, given natural immunity and then those who are immunized?
Well, that's really the big question heading into the winter. I mean, I think it's predictable we'll see more cases than we have been seeing in places where people are going indoors, but will it really lead to more hospitalizations in a very serious way that threatens the healthcare system? The projections, some of them are very confident that we won't see that kind of crisis. But you never really know. And I think what we've learned with COVID is until it happens, you're not completely sure. And the best thing is to take precautions. I think that obviously getting everyone vaccinated now matters. And when people are in close quarters with others who may not be vaccinated, wearing a mask for the winter, I think, is sensible.